My name is Celine Stamper. I'm a lieutenant, a nursing officer with the Canadian Armed Forces. I've been working at long-term care centers in Montreal. I'm a new nurse. I graduated nursing school just last summer, so this is all new to me. I never thought that when I graduated last year I'd be working in a pandemic, working at a long-term care center in Montreal, where I'm not from. It's really opened my eyes to nursing in general and the care that we give, and there was a lot of residents that we got to know. In particular, there was a couple who actually shared a room, and they've been married for over 40 years, and they were able to stay together in the room. They beat COVID and together, which was really amazing. When you think long-term care, sometimes you think more slow paced, but that's not the case at all. You could tell the staff was so appreciative that we were there. It kind of took a load off their shoulders. We were able to help out where we could. Going into a province where we didn't speak the language, like the team and I are all Anglophones, so we were worried that it would be difficult, but everyone was very, very welcoming and so appreciative. People on the street would stop us and thank us for what we were doing. So it's just the welcoming community of Canada. What's been motivating me through the pandemic is having my support of my spouse. My spouse is in Petawawa, so we FaceTime every few days. My dog always gets on the phone and he's wiggling his tail every time he hears my voice, which has been really cute. I also have the support of my team here. I don't think I could do it without the social support. To everyone, happy Canada Day.
Hi, my name is Elsa Leon and I'm a nursing teacher, and during this COVID pandemic I decided to come and help out in the long-term care facility in the West Island of Montreal, Quebec. I decided that I just couldn't help myself. I had to get out there and do what I could. After I volunteered, my brother was very vocal about, sharing how he was proud of me. And then when his work became more quiet, he also decided to volunteer, and we ended up getting stationed together. When it started to get clear that I had symptoms that could possibly be COVID, I just had this sinking feeling. Then when my results came back positive, I was devastated. Being worried about spreading it to my kids and my husband, that was very nerve-wracking. Once those 2 weeks were gone and they did not get sick and I was able to leave the house, I just felt, completely relieved and happy. It was incredibly difficult work, but incredibly rewarding. And I wouldn't have it any other way. This is a time which takes so many people, a lot of resources to come together and work as a team to be able to do the best for everyone around us. Happy Canada Day.
My name is Jake Sanford. I'm an advanced care paramedic in Halifax, Nova Scotia. I'm part of a field assessment unit. It's a unit that performs testing for people that are suspected to have the COVID-19 virus. They can be tested safely in the home for certain populations that otherwise wouldn't be able to make it to testing sites. To be able to be part of a group of people that can help this battle against the virus is an opportunity that I relish, and I'm glad I can be a part of it. Most interaction that I have with the public is very positive. There has been a lot of struggles that I think everyone across the country has been going through lately, but I think that everyone really kind of understands that we're all in this together. I have a 2.5-year-old son and my wife. This has been a trying time for our family, the same as any other family, so I relish the time that I can spend with them. We have a very close, tight community, particularly here in Nova Scotia. There's a lot of close families, there's a lot of close friends, and I know that across the country, if we have particular issues that we're feeling here, I know that that's felt across the entire country. I'm very fortunate to be part of Canada. I'm very proud Canadian, and I'm very proud to be a paramedic for this country for those reasons. I've never been part of such a large team, and whether that be someone that's in the paramedic role or someone that works at the grocery store or any other frontline worker, to have such a common goal across kind of all these different platforms and all these different work environments, I think that's a pretty cool thing to be a part of. Happy Canada Day.
My name is Gerald Blanc. I am an environmental cleaner in the ICU unit as a extra COVID cleaner. So I basically am working Monday to Friday, 12 to 8. When I come to work, I go and get a cart together and I start to clean all touch surfaces, including handrails, as well as the sinks and the bathrooms and anything that people touch, as well as cleaning the rooms. We make sure that we take care of each other, the doctors, the nurses, as well as the cleaners. So I was actually quite confident that I could go into there, but yes, I was nervous at first for sure. My initial concerns were that I've never really been around the COVID virus, so I didn't know how to deal with it. I would say that it has definitely changed me personally. I am a single dad of 2 boys, both 16 and 19 years old. When it was first began, I had to not see them for a little couple of weeks, and that was tough. But they also are working in grocery stores as well. I think we make a difference because we also sometimes interact with the patients as well. And I find that in the unit when the family wasn't able to come in, it made a huge difference for, just maybe they could hear us. My hope for Canada is to continue being the kind of people we are. We have a very diverse society. We also have wonderful hospital care. We're very lucky to have the healthcare system we have. I just hope that every one of us appreciates this wonderful country we're in. Happy Canada Day.
My name is Paul Coblitz. I'm an emerge physician and I work at Mount Sinai Hospital in downtown Toronto.
And my name is Yashi Athindra and I'm also an emergency physician and I work at North York General Hospital in Toronto.
And our job description is still largely the same, except now there's this invisible lethal virus that we have to assume everybody has.
And we have to make sure that we ourselves are protected with full PPE so that we don't actually bring that virus home to our families.
I think that the real important thing to note is that there are hundreds and thousands of other people across the country who are doing their part and are working through the same risks as we are. So I don't necessarily think that we're standouts or making that much more of a difference than they are. The nurses see these patients many, many more times than I do a shift.
Social workers, I think, have been huge, and geriatric nurses as well. There's so many people doing such an incredible part, and we're just a small part of that. I'm so proud of the people in this country for banding together and quarantining themselves for months to help make sure that our hospital systems didn't fall apart and make sure that we are safe.
I thought you were at work!
I'm just so proud to be a part of this country, and to me, Canada is love.
To me, Canada is being kind to one another.
Happy Canada Day!